So for my last BBL Q&A, I got a bunch of comments asking me to make another video answering some more, so let me get into it. The first question I got a lot was, what is my height? I am 5'2". A lot of people were also asking me to show some before and after pictures, so I'm gonna insert my before picture that many of you have seen. I was 100 pounds in this one, and then one of my most recent pictures right before surgery at 127 pounds. A lot of people were also curious about how you sleep after your BBL surgery, and you are required to sleep on your stomach. Some surgeons recommend different time periods on how long you're supposed to sleep on your stomach, but if I remember correctly, mine told me to sleep on my stomach for at least 6 weeks, solely on my stomach. He told me not to sleep on my side, not my back, nothing, just stomach. And coming from a back sleeper, this was actually one of the hardest parts of recovery. I got little to no sleep for the first 2 to 3 weeks after surgery. It was not fun. I've seen some people get like those pregnancy wraparound pillows that really help you sleep on your stomach, or just moving around your normal bed pillows in some ways for support, because it can get really annoying really quick when you are only allowed to sleep on your stomach. Also, you're not allowed to sit on your butt for 6 to 8 weeks also, to not damage your results. And that is also very, very tricky. Because I wasn't a big fan of laying on my stomach, most of the time I would just stand. For majority of my days, I would just stand. Because they also don't recommend you using your butt pillow too much, because you're just not supposed to be sitting. I also got a question about using the restroom. I've seen people do a lot of different methods. Some people have bought tools that help you stand and pee. I actually bought one of those. I can insert a picture of the one that I bought, and I did not find it useful at all. I feel like it made the experience just a lot harder. So for me, I would just sit on the toilet. I didn't see it as a problem too much because they were just really quick trips to the restroom. I wasn't sitting there for a while, but there are a lot of ways you can try it. I've seen people sitting backwards on the toilet. I'm not sure if that helps more, or just like I said, there's devices to help you stand and use the restroom. Going number 2, on the other hand, was not as easy. This is about to be a little bit TMI, but in doing research, I watched a YouTube video about a woman that said to get extra large wipies. Because right after surgery, you're very like stiff and sore, and it's kind of hard to reach back to clean yourself. And so in a sense, what you can do is get extra large wipies and honestly kind of like floss it. That is a lot of TMI, but that is what helped me. I used that method for about 2 or 3 weeks post-op because I was just so swollen and sore, and it was just really hard to reach anywhere. Someone also asked about taking off the compression garment. You're supposed to wear it 24/7 for at least 6 weeks, but you can take it off to shower or wash. The first couple times I took mine off, I did get a little lightheaded, but I didn't faint or anything. It didn't really hurt, honestly, like the physical taking it off, it didn't really hurt. I was like sore and stuff, so it was like uncomfortable, but no, it did not hurt. It just like, I guess the compression release once it's off kind of like rushes blood to your head and you get lightheaded. Some people do faint, so you have to be careful when you do so, but for me, it really wasn't that bad of an experience. I was also asked how I maintain my weight being so small, which honestly is still a very big concern of mine. I am trying really hard to maintain my weight, because obviously if you lose weight, it's hard to target where the weight is being lost. And so I have this big fear that if I accidentally start losing weight, that my butt will go with it. And so for me, I really am just trying to eat healthy and go to the gym, make sure I have enough calories every single day, protein, all of that. I don't have like a specific diet plan. I kind of just know my body and see what is working, see what's not. I don't really have an exact science to it. I really am just like going with the flow, seeing what's working, seeing what's not, seeing how much I should eat or shouldn't. Like weight gain, weight loss, it's kind of just like you should know your own body and know how it fluctuates. That's just what I'm going by. Another concern many people had was what it feels like to touch, and honestly, I feel like it feels exactly the same as before. It feels extremely natural. I've heard that some people feel lumps or see lumps or all these things, but I did not experience any of that. It all is just completely natural to touch everything. It just feels like a butt. But I would say that I have been experiencing this recently, that it starts to hurt if I sit too long. I've talked to a couple of people that have had a BBL, and they say that they also feel discomfort if they sit for long periods. And the best way to explain it would be like kind of a numb tingling feeling, and it's just like really, really uncomfortable. I have to like adjust or stand, and I didn't see anyone talk about that before I did my surgery, so I'm honestly not sure how long that'll last. A couple of people I talked to, they're all around like the 1-year mark and they're still experiencing that, so I'm not sure if that is a forever thing, but I hope not. The last question I got is what I asked my surgeon for specifically. And honestly, I had a couple pictures what I wanted to show him of the results that I wanted, but they only let me meet the surgeon 20 minutes prior to surgery, and they took all of my belongings to prep me for surgery, so I didn't have my phone or anything, so I couldn't show him any pictures. But I talked to him and he basically just pointed out my problem areas, which were my hip dips mainly, and like where my back and butt met. And so he just said he was going to focus on that mainly, and that's what we agreed on. So those are all the questions I have for now. If you have more, feel free to leave them in the comments below. My next video will be about my bad experience with CG Cosmetics because a lot of you want to know in detail what happened. So just look out for that one next. I'll also have my socials linked in the description if you want to DM me and ask me some questions there. I've been pretty good at answering everybody so far, so if you have any questions, let me know, and thank you for watching.